Imagine this. After a dinner you believed was flawless, steamed vegetables, a light salad, you slip into bed with the satisfaction of having nourished your body the right way. But when morning comes, something feels off. Your words tangle, your arm feels heavy, or a strange dizziness washes over you. Many people assume this kind of scenario is caused by fried foods or sugar, yet the truth is sometimes far more unsettling. The danger can come from a food you believed was your greatest ally. Yes, a vegetable. A vegetable praised for years as a protector of the heart and brain, but one that, after the age of 60, can quietly increase the risk of a stroke during the night. It's a situation I've seen far too often among older adults over the years. A food that is beneficial at 40 can become problematic at 70, especially when combined with certain medications or eaten at the wrong time of day. Fortunately, the point is not to fear your plate. It's simply to understand how your body evolves. Today, we will reveal 9 very common vegetables that can subtly raise the risk of stroke after 60, along with simple ways to continue eating them safely. Before we go any further, consider subscribing and activating notifications so you never miss an essential piece of guidance. And the final vegetable on this list is one of the most frequently eaten by seniors every week, and perhaps the most deceptive of all. Let's begin. Chapter 1. Spinach. The ally that can turn against you. Spinach has long been praised as a nutritional treasure, rich in iron, magnesium, and antioxidants. Yet after the age of 60, this celebrated superfood can shift roles if it's consumed the wrong way. The issue is not the spinach itself, but how the body responds to some of its compounds as it ages. The main concern is oxalates. These compounds bind to calcium. In younger adults, the kidneys clear them easily. With age, this process slows, blood vessels stiffen, and many seniors take calcium or vitamin D supplements. In this context, the balance becomes fragile, because the body no longer eliminates these crystals as efficiently as before. The result is the gradual formation of tiny calcium oxalate crystals that can slowly narrow the brain's small arteries, like grains of sand clogging a thin pipe, subtly reducing circulation without any obvious warning signs. The solution is simple. Enjoy your spinach earlier in the day and avoid pairing it too often with calcium-rich supplements. This small adjustment is often enough to preserve the vegetable's benefits while limiting its unwanted effects. If insights like these are helpful to you, consider supporting the channel by subscribing. It allows more seniors to access essential health information. Spinach remains a valuable food, but after 60, it requires specific guidelines to continue protecting your health, rather than quietly working against it. Chapter 2. Broccoli and its silent interactions. Broccoli is celebrated as one of the best foods for heart health. Yet for people taking blood thinners, this vegetable can quietly disturb the body's delicate balance. This paradox often surprises because it's hard to imagine that such a healthy food could interfere with an essential treatment, especially when it's routinely recommended for healthy aging. The reason lies in its high vitamin K content. This vitamin helps the blood clot, which is beneficial, unless you are taking anticoagulants such as warfarin or aspirin. In that case, every fluctuation in your broccoli intake influences how your medication works. When these two forces pull in opposite directions, the body struggles to maintain proper stability, and the dosage becomes difficult to fine-tune. Irregular consumption can leave your blood either too thin or too thick, quietly increasing the risk of stroke without producing any clear warning signs. It is this absence of symptoms that makes the interaction so insidious. Everything appears normal until the balance finally gives way. There is no need to eliminate broccoli. Simply consume it regularly and in moderation, and inform your doctor about your eating habits. This small step allows your treatment to be adjusted correctly, enabling you to enjoy the full benefits of broccoli without exposing yourself to a silent yet very real risk. Chapter 3. Romaine lettuce and the nighttime trap. A light salad in the evening may seem like the perfect idea, yet romaine lettuce can become problematic after the age of 60 because of its mild diuretic effect. It's a subtle phenomenon, almost unnoticeable, as it causes no discomfort or immediate signs. But this slight stimulation of the kidneys gently increases water loss late in the day. just as your body naturally begins to reduce its hydration levels. During the night, when hydration drops even further, this can thicken the blood and slow circulation, increasing the risk of microclots. As we age, blood vessels lose flexibility, and the body's ability to compensate for these shifts diminishes, making this effect more significant than most people realize. In this way, a simple bowl of salad eaten too late can influence blood fluidity and circulation for several hours, without you having the slightest awareness of it. The solution is simple. Enjoy romaine lettuce earlier in the day, or accompany your meal with a small glass of water to counterbalance its effects. This small adjustment protects your nighttime circulation while allowing you to enjoy romaine lettuce without consequences and without giving up a dietary habit that is otherwise highly beneficial. Chapter 4. Raw carrots and the glycemic reaction carrots are a universal symbol of health, yet when eaten raw and late in the day, they trigger a rapid rise in blood sugar, followed by a sharp drop during the night. This effect is deceptive because it comes with no immediate symptoms. You feel as though you've made a healthy choice, while your body is actually facing a sudden and intense shift in glucose levels. This nighttime glycemic whiplash disrupts metabolic balance and places the body on high alert at a moment when it should be repairing itself and winding down. The drop that follows activates stress hormones that constrict blood vessels, thicken the blood, and can weaken cerebral circulation, especially if this pattern repeats several times a week. With age, sensitivity to these fluctuations increases, making the effect even more pronounced in older adults, often without them understanding the cause. Eat raw carrots earlier in the day and pair them with proteins or healthy fats to stabilize absorption. This slows their entry into the bloodstream and prevents abrupt swings. A simple adjustment, yet enough to protect your sleep quality and your nighttime circulation, all while preserving the many benefits of raw carrots. Chapter 5. Garlic, a remedy that can become too powerful. Garlic naturally thins the blood, a valuable benefit, unless you are already taking anticoagulants. This vegetable, often seen as a harmless ancestral remedy, has a very direct effect on circulation. When combined with blood-thinning medications, garlic can make the blood excessively fluid and increase the risk of internal bleeding, including in the brain. This risk is even greater because many people underestimate the true strength of raw garlic or highly concentrated extracts, believing they are simply adding a harmless, natural boost to their health. In reality, this silent interaction can significantly alter the effectiveness of your treatment and weaken your body's ability to stop bleeding when necessary. The rule is simple. Avoid concentrated supplements and choose cooked garlic in small amounts. Cooking softens its effect and allows you to enjoy its benefits without disturbing the delicate balance of your blood clotting. If you're enjoying this video, leave a like to support our work. It truly helps us continue. Chapter 6. Onion and the risk of excessive blood pressure drops. Onions contain quercetin, a molecule that relaxes blood vessels. This action is generally beneficial, helping blood flow more freely and reducing strain on the vascular system. But when combined with blood pressure medications, the effect can become too strong. Together, they can lower blood pressure to the point of reducing oxygen delivery to the brain, especially at night when blood pressure naturally declines. In sensitive individuals, this drop can trigger sudden awakenings, mild morning dizziness, or an unusual fatigue whose cause is difficult to pinpoint. The connection to onions is often overlooked because the food seems harmless and its effects unfold quietly, almost imperceptibly. Enjoy onions cooked and avoid meals that contain large amounts of raw onion in the evening. Cooking softens their vasodilating effect and minimizes this risk, allowing you to benefit from their properties without disturbing your nighttime blood pressure or affecting the quality of your sleep. Chapter 7. Corn, the false vegetable and true starch. Corn behaves in the body like a starchy food. It triggers glycemic spikes comparable to white bread, an effect many people underestimate because corn is often viewed as a harmless vegetable. In older adults, these rapid surges in blood sugar, followed by equally abrupt drops, create hormonal roller coasters that tighten the arteries and thicken the blood during the night. This sudden shift puts significant strain on the cardiovascular system and can silently disrupt cerebral circulation, especially when corn is eaten in large quantities or at dinner. Over time, These repeated fluctuations exhaust the body and make it harder to maintain stable glucose levels. Enjoy corn sparingly, never on its own, and always paired with proteins or healthy fats. These combinations slow sugar absorption and help reduce unwanted effects, allowing you to enjoy corn without putting unnecessary pressure on your nighttime circulation. Chapter 8, Asparagus and its Nighttime Dehydrating Effect. Asparagus, elegant and light, is nevertheless a natural diuretic. This detail often goes unnoticed because its effect is subtle and does not necessarily cause repeated trips to the bathroom. However, when eaten late in the day, it can deepen nighttime dehydration, precisely when the body naturally reduces its fluid intake. This additional loss of water slightly thickens the blood, and in individuals with fragile vessels, can encourage the formation of small clots that struggle to circulate. As we age, these fluctuations become more significant, as the vascular system reacts more slowly and tolerates abrupt hydration changes less effectively. Once again, enjoy asparagus earlier in the day and stay properly hydrated. This simple adjustment allows you to benefit fully from its properties without placing unnecessary strain on your nighttime circulation. Chapter 9, Tomato, the icon that can disrupt your circulation. Tomatoes contain compounds that can trigger unpredictable shifts in vascular tone and nerve signaling. These fluctuations are not always noticeable, yet they can subtly influence how your blood vessels respond throughout the day. Their high acidity can also disturb the balance of essential minerals such as calcium and magnesium, two elements crucial for stable nerve and muscle function. The result, sensations of dizziness, headaches, or numbness that are sometimes mistaken for early warning signs of a stroke, especially when tomatoes are eaten in large quantities or too late in the evening. Choose cooked tomatoes, which are gentler and richer in easily absorbed nutrients, and avoid tomato-heavy meals right before bed. This approach allows you to benefit from their advantages without risking disruptions to your nighttime circulation or neurological comfort. These 9 vegetables are not your enemies. They simply require a different approach after the age of 60. As the years pass, your kidneys slow down, your blood vessels grow more delicate, and your hydration levels fluctuate more easily. It's not only what you eat that matters, but when, how, and with what you choose to eat it. By adjusting a few simple habits, paying attention to your body's reactions, and staying in communication with your doctor, you can maintain full dietary freedom while protecting both your brain and your heart. If this content has brought you clarity, consider subscribing and turning on notifications to stay informed. It supports you, and it also helps other seniors remain strong and independent. Aging does not mean decline. Aging means learning to master your own rhythm